My AARP membership opens the door to hundreds of unexpected benefits. From travel and dining to health and wellness, there's more than I could have imagined. Here, take a look. Finding benefits near me is easy with the AARP website or on my phone with the AARP Now app, which also gives me access to my digital membership card, news, and local events. I can even use my membership to get a phone discount. Plus, now that I've picked up my groceries, I can also eat a little better with delicious, healthy recipes on the AARP website. I can go see movies with free screenings through Movies for Grown-ups. I can hit the beach or go on tours with travel planning and resources for every budget. And I can easily hit the open road with access to motorcycle and auto insurance, car rental discounts, and a driver's safety course. As you can see, membership has a lot to offer, giving me access to insurance, work and jobs resources, financial and health tips, as well as shopping and grocery discounts. Not to mention there's loads of information to help me take care of my mom. And there's plenty more at aarp.org/explore now. Now, if you'll excuse me, I'm going to go out and use some of my member benefits.
Welcome everyone once again to this virtual Latino Book and Family Festival. Bienvenidos a todos una vez más a este evento virtual de Libros y Familia. We are so excited that you can join us today. I am your MC for the day. My name is Alina Gonzalez. A little bit about myself. I published my first book at 17 years old, and I attended undergrad to get my bachelor's in film in New York at Hofstra University. I received my first master's at USC in teaching in 2020, and I love education so much that I am currently working on a second master's program in film and media studies at ASU. Estamos muy emocionados que están compartiendo su tiempo con nosotros. Hoy seré tu maestro de ceremonias. Mi nombre es Alina González. Yo publiqué mi primer libro a la edad de 17 años. Asistí a la universidad en Nueva York y recibí mi maestría en 2020 de la Universidad de USC. Estoy fascinada de estar con ustedes promoviendo la lectura porque me encanta leer y aprender. This event seeks to share information about resources, programs, and events from which we can all learn. Este evento comparte información sobre recursos educativos, programas y eventos culturales. This program is brought to you with the support of some of our partners. As you just saw the video from AARP, we want to highlight AARP California for their second year as a partner with Empowering Latino Futures and their support for the Latino Book and Family Festival. Thank you for all your support. The purpose for the forum today is to provide information on health resources, opportunities the community should be aware of, and how to access them. For today's health forum, we invited a few representatives of health to share with us about their health institutions and the resources they provide. El propósito de este foro es proveer información sobre recursos de salud, oportunidades que la comunidad necesita conocer y cómo acceder a estos recursos. Para el foro de salud de hoy, invitamos a varios representantes a compartir con nosotros sobre sus instituciones de salud y los recursos que proveen. For today's presentation, with AARP California Programs and Resources, we have Kimberly Smith and Liz Derault, who will provide an overview of AARP California's focus areas and work in the community and across the state. We will share more about local offerings in San Diego and cover resources around caregiving, livable communities, fraud and scam preventions, and more. Any links, pages, videos, and social media can be found on their Facebook, AARP California, and their Twitter, Instagram, which are the same handle at AARPCA, or their website, aarp.org/California. Welcome, Kimberly and Liz.
Good morning.
Good morning. Hold on. Good morning. Buenos días a todos. Soy Kimberly Smith, Kimberly Smith de la Fuente, directora regional para AARP. Es un placer de estar con ustedes hoy y estamos muy agradecidos al Latino Book and Family Festival por habernos invitados. Es un evento espectacular. And as I was saying, I'm Kimberly Smith de la Fuente, here to talk a little bit about AARP with my partner, Liz DeRoulet. And I want to tell you about something. AARP is probably one of the most misunderstood organizations, and there's reasons for that. We, just to clarify, we are a complete nonprofit. We don't sell anything. We don't move anything. But what we do is endorse socially responsible products that offer bulk buying advantages to our members. So for that, we loan our brand, our logo. So you may see that on various different agencies. But the revenue that comes from helping that brand comes back to the States, comes back to San Diego, so that we can free programs, free events, and do good work in advocacy, education, and information. So one of the things I wanted to say, we are a totally volunteer-driven organization that from our higher levels and right down to our state level. And we have a cadre of amazing volunteers throughout the state. And we couldn't do the work we do in the communities without them. So there's a lot of different stuff we do that you may not be aware of. We do so many great programs, free programs. You might have seen a little bit in our commercial, but this is very different because we're very local. So with that, I would like to introduce our leadership volunteer, also in North County, like I am, Liz DeRoulet, who will work you through a couple of our slides to maybe explain a little bit better what we do here in San Diego, so you can know some benefits and maybe take advantage of them. So you take it away, Liz.
Thanks, Kim. Good morning, everyone. And my name is Liz DeRoulet. I live in Oceanside, California. I've been a volunteer for AARP for about 3 years. But if you notice, I didn't say an active volunteer because COVID has actually kept us all in our houses. So nevertheless, I'm delighted to be here with you all virtually today and share more about AARP California. As Kim mentioned, AARP is a nonprofit, nonpartisan organization with a membership of 300 million nationwide and over 3 million of us members in California. AARP works on behalf of us, age 50 plus, and our families to empower people to choose how we live and how we age. AARP is a champion of positive social change and delivers value through advocacy, information, and service. Over the last 10 years, AARP's focus has shifted from being a national organization to one that is creating relevancy and impact at the local level for our members in our neighborhoods and communities where we live. Next slide, there.
Discovered a retired teacher living, no home, no health care. So she said no to this injustice and yes to transforming lives. It's this drive, this compassion that inspired AARP. Today, we empower people to choose how they live as they age. We advocate for health and financial security. We strengthen communities everywhere. We are AARP California, creating real possibilities.
So AARP California is the largest of AARP's 53 state and territorial offices, representing more than 3 million members with local office locations in Pasadena, San Jose, and Sacramento. We also have staff and volunteers supporting the San Diego Information Center. And hopefully, if you have an opportunity, you'll be able to go down and visit our informational center in San Diego. AARP has approximately 30 staff and more than 55 volunteers like myself across the state, serving the 3 million members of AARP California. And they serve us through community engagements, programming, and advocacy. As we said before, after finding a retired teacher living in a chicken coop, Dr. Andrus founded the National Retired Teachers Association in 1947 to help protect and advocate for retired educators. Then in 1958, she founded AARP, an organization that has continued to grow and serve all older adults and their families over the past 60 years. There are 8 domains of livability. In 2010, older adults were 13% of the population. Today, 1 in 3 Americans is age 50 or older. By 2030, 1 out of every 5 people, or 20% of the population of the US, will be 65 years or older. Getting ready for tomorrow becomes especially critical in light of AARP's research that consistently shows that 86% of us, the 50+ community population, want to remain in our homes as long as possible. That is why AARP's California focuses on livable communities. And we define livable community as a livable place for all ages. Its common features are a place that is safe, has usable outdoor spaces, provides opportunities for work and play, and includes needed services and effective ways to get around, no matter a person's age or life stage. It is centered on 8 areas, also known as the 8 domains of livability. These focus areas, which drive much of our advocacy work, are housing, social participation, respect and social inclusion, civic participation and employment, communication and information, community support and health services, outdoor spaces, buildings, and transportations. Okay, social change agenda. Next slide. Whether AARP is providing educational resources for California's 4.4 million unpaid family caregivers, or increasing opportunities for the over 7 million working Californians who don't have access to retirement savings at work through support of the CalSave programs, or enrolling local jurisdictions in AARP's network of age family-friendly communities, or providing technology workshops in the community. AARP's works aligns with the commitment to help create more communities that are livable for people of all ages. I've touched a little bit about California's work, but it's also important to know that AARP does what it does with communities and not doing things for a community in an effort to create lasting and impactful change. We in our community decide what's important and work within the AARP framework. Working with San Diego. In San Diego County, AARP has worked across North, Central, South, and East Counties communities on strengthening engagement and relevancy through the power and efforts of communities like myself who understand the community's values. AARP has teams in South County, Central County, and we're building a team in North County. Hence my excitement about AARP's involvement. At the local level in San Diego, our advocacy efforts have focused a lot on housing, transportation, and open spaces, also known as the built environment. But as you can imagine, this year's health and monitoring the impact of the coronavirus has also been a key area of focus. Much of the work here in San Diego is volunteer driven, with AARP staff as support for our passions and interests that are aligned with AARP's missions. When AARP was doing in-person events, we had some signature events that were strong volunteer supported events, like the Dance for Healthy Living or maybe you all saw the San Diego Union Tribune Successful Aging Expo. Now, in the virtual space, we have pivoted to online events, sharing information with our local communities through tele-town halls, educational workshops, virtual tours, fun events, and more. Working with volunteers and partners. AARP has worked through partnerships in the community, and volunteers are critical to this work because we bring a credible and relevant face to the work. AARP has had a tele-town hall where a volunteer was the moderator with Dr. Wilma Wooten and Supervisor Nathan Fletcher. Maybe some of you actually caught this tele-town hall. Our volunteers, Bob Kraft and Joe Garbanzo, led the age-friendly work and have been the representatives for the County of San Diego, bringing the voice of older adults to important issues. We also have Barry, who works presentations on brain health, and of course me, who I've done a presentation for the Women's History Month on our founder, Dr. Ethel Percy Andrus, and now today with you all. Okay, we'll just. Slide 9.
Great.
Okay, relevant events. AARP also sponsors and participates in cultural events, or what we like to call fun with purpose events, my favorite category of involvement. Events include Route 66 Mariachi Festival, Chula Vista Harbor Fest, the Latino Book and Family Festival, and many more activities. In San Diego County, AARP continues to expand their work within the region and within the Hispanic, Latino, African American, Black, and Asian American Pacific Islanders communities. Our area of focus include livable communities and advocacy, caregiving, fraud prevention, and financial resilience. Please connect with us if any of you are interested in getting involved, especially anybody in North County who would like to work with me in getting involved. Nationwide programs. AARP has also provided various programs throughout California. AARP works comprehensively on technology education programs, and these programs are called AARP Tech, which works to close the technology gap for older Americans like myself by offering free hands-on education sessions. The AARP Foundation Tax Aid Program, which is probably one that many of us are more familiar with, is the nation's largest free tax services that enables bilingual volunteers to work directly with low to moderate income taxpayers. The Driver Safety Program, which focuses on keeping older drivers behind the wheel safely for as long as possible. These driving courses can be taken by anyone and oftentimes result in reduced insurance fees. Movies for grown-ups, which are very common in San Diego area, allows our members and the guests to enjoy free pre-screenings of major Hollywood films. One of my plans is to make certain once we get out of this coronavirus that we start having movie for grown-ups here in North County. Job search in the digital age workshops is what also provides for us elderly, some of the elderly who choose to work, which provide an opportunity for folks like ourselves to explore the latest job search websites and apps and learn how to set ourselves apart from their competition and ace interviews. So stay in touch. Yes, stay in touch with AARP California online to learn about our latest efforts and events. And if any of you are eager to get involved, which I hope you are, please email Tiffany Sang at her email address. And I'm looking forward to having some, not so many virtual opportunities, but some in-person opportunities. Thank you all.
Thank you to our partners at AARP California. I did want to ask a few questions for those that we have representing AARP for our viewers to be aware. So what are current events either happening within this month or the coming month that our community can come and participate in?
I can answer that unless Tiffany wants to, because she's the expert. So there she is. Voila.
Thank you so much for having us here, and I love that question. Two that just come off the top of my head that are happening pretty soon is on September 17th, we will be doing a 6 Pillars of Brain Health workshop, which just gives an action plan on how to support your brain health. And then on September 30th, we're super excited to do a Hispanic Heritage Month celebration with Dr. Alberto Pulido from the University of San Diego, and he'll be doing a tour of Chicano Park and the history there and talk more about that. What's great is it's virtual, so you can tune in from home and hear more about it. So we're really excited about some of those events happening. But if you check out our website, aarp.org/near you, there will be a whole list of tens and tens of events that are happening.
Awesome. Thank you. Now, my next one is kind of like a personal question that I'm just inquiring about because I did see a TikTok saying that you do not need to be over the age of 65 to join AARP. You can be, I'm 25, so am I eligible to join AARP to receive some of these, maybe like those movie benefits, catching some of those screenings? Is that real, or was that cap on TikTok?
Yeah, let me take
No
that.
cap.
Yeah, absolutely. No cap. Yeah, TikTok is a new world for us, but we're getting there. But no, I've been working for AARP for 20 years, and my daughter became a volunteer when she turned 18, even though she had been working in the field with me in many areas of the state. Yes, you can be an associate member at any age, and this allows you the magazine, which is an incredible, it's the most circulated magazine in all of the country. You might have to fight for the discounts a little bit, but it really is, it gives you access to information, advocacy if you're interested in, how we can make things better in this world. So you can sign up for various newsletters, and yeah, you don't have to be 50. My son just joined and he's 27. So it's all good. Join and you'll see. And it's, just get in the loop so you can understand all of the potential that we have, not only for collaboration, but to offer services to the community.
And for fun. I'm glad she's eager for the movies for grownups because it is fun.
Oh, yes. I'm really happy that was fact and not cap. I do want to take a moment to invite our audience members. If anyone has any questions, I am keeping live with our Facebook streaming that we have there. So just drop it in the chat. Let me know where you're coming from, and I will give you a shout out and make sure that we get your questions answered by some of our wonderful panelists. I do have one more question for you ladies. And that is, Tiffany did mention that one of those events would be virtual. And are you guys seeing more of like a hybrid sense for the future of virtual and in-person events? Or are you hoping to transition just towards one platform or the future, because of the pandemic and how that has been, keep some of these information sessions in a hybrid place?
Definitely. I think that's a really great question and that everyone's been asking lately. And I will say, regardless, hybrid is here to stay. I don't think virtual events are going to go away. Right now, we are operating under no in-person events, and it's just important to protect our members, protect our staff. So I think even as we kind of move out of this place of no in-person, we're still going to offer virtual and in-person to engage our members in new ways. And it's been great to reach people virtually who maybe weren't able to attend before. So we're really excited about that. Do you mind if I quickly touch on something, just because I know this is a Latino Book and Family Festival? We do have resources in Spanish. So the AARP website does have a Spanish version and different resources there just in case. And we do have staff who can support that way. And We're also, like Liz was so kindly plugging, we have, 38 million members across the US and 5,500 volunteers in California, but we're always looking to have more people who want to get involved and serve. And it's hopefully a lot of fun, as you can tell, and it's a good cause.
Yes, thank you. And thank you for mentioning that you do have these resources available in like a bilingual setting, English and Spanish. That is great for our viewers to know. Well, thank you, ladies. And I hope we will get some questions rolling in that we can ask later on in the event, but it was great to have you on for now.
Thank you. Bye-bye, bye-bye, bye-bye.
So next we have Blue Shield California with Dr. James Cruz. He is the Chief Medical Officer of Blue Shield California Promise Health Plan. Dr. Cruz has dedicated his career to serving California's diverse communities of color. Dr. Cruz is currently the Chief Medical Officer for Blue Shield of California Promise Health Plan. Promise Health Plan is Blue Shield of California's Medi-Cal Medicaid health plan. Prior to his arrival at Blue Shield of California, he was a principal for Health Management Associates, a national healthcare policy firm which provides consultation services to healthcare systems, hospitals, medical groups, and state agencies to help them address the needs of low-income and vulnerable populations receiving government-sponsored healthcare services. Dr. Cruz graduated from UC San Diego School of Medicine and the Family Practice Residency Program at the White Memorial Medical Center in Los Angeles, California. He is a board-certified family physician. Dr. James Cruz, it is such an honor to have you with us today.
Well, good morning. Thank you, Alina, for that very warm greeting. And I'd like to thank the Empowering Latino Futures and the Festival Committee for inviting us here today, this morning, to speak to all the attendees. As you mentioned, I'm the Chief Medical Officer for Blue Shield of California Promise Health Plan. And in that role, my responsibility is to oversee the clinical services that are provided by the hospitals, doctors, and other providers of healthcare that work with us at Blue Shield of California Promise Health Plan, as well as making sure that the members, the Medi-Cal members that are taken care of by Blue Shield Promise Health Plan receive the quality clinical care that they deserve, as well as have the outcomes, quality outcomes that we're looking for. If I could go to the next slide, please. And we'll go, well, before I go on, one of the things I want to thank you, we'll stay there. We've seen this year that COVID-19 has been a destroyer of lives and livelihood in the Latinx as well as other communities of color. And now more than ever, it's important to build awareness in the community of resources that are available to help us all through the pandemic and afterwards. So I'd like to give you an overview of some of the services and the resources that we provide to help and work with the community and Medi-Cal members that are with Promise Health Plan. As you know, it's important for us to share that we support and are champions of health equity and social justice in underserved communities. And how do we do this? Well, we're led by healthcare professionals, nurses, physicians, individuals that are healthcare professionals and public health trained individuals with a commitment of making our members, our Medi-Cal members, first, and the communities that they live in first. And that philosophy commits us to building a quality network of hospitals, physicians, and also to partner with community organizations for our members. We work to bring both culturally and linguistically and socially accessible services and healthcare to our members. And equally as important, we invest in our members' well-being, as well as the communities where they live and the organizations that serve them. Next slide, please. And the services provided, as I mentioned, we are a health plan that provides healthcare to those individuals that are eligible and are on Medi-Cal, which is the health plan that's sponsored by the state of California for individuals with low income, as well as the Cal MediConnect program, which is a program for low-income individuals that are on Medi-Cal, but also are eligible for Medicare because of their age. So we provide health care for both of these individuals that are eligible for both of these programs. So next slide. So how do we do this? So we invest in local communities, and we'll talk a little bit more about the communities and some of the investments that we've made hand in hand with our community partners on the next couple slides. But just to kind of point out that, as I mentioned, we are a champion of social justice and are striving to eliminate healthcare inequities through innovative efforts to work with our communities, especially through, we have a health navigator program where we have individuals that work with a member to help them navigate through some of the very confusing aspects of the healthcare system. We champion access to quality care for all San Diegans through our $500,000 statewide investment in a Blue Sky initiative, which is truly special in that it supports diversity and mental health care workforce to help provide individuals to select a career in mental health care that look like us. And also we have a San Diego Care Coordination Program that works with the County of San Diego Mental Health Department and also with Blue Shield, our Promise Health Plan, to provide mental health care support to all San Diegans. Overall, we help people live their best and healthiest life by connecting them to essential community resources such as healthcare, housing, sources for nutritious food, and homeless support services, as well as behavioral and mental health services, and assistance with substance abuse support. So these are just a few of the investments that we make. Next slide, please. So here's sort of a more comprehensive list of some of the programs and that we support throughout San Diego and other parts of California as well. And I said we are especially committed to continuing to focus on COVID-19 vaccination and outreach to low-income communities, because those have been the communities that have been most severely impacted by the COVID-19 virus. But also we support mental health, health equity, and social determinants of health to make sure that members have access to the vital services that they need. Just in short, we've provided $1.2 million in the last year to support community-based organizations and health centers throughout San Diego during the hardships they faced during the pandemic, because many healthcare providers and community-based organizations really were having difficulty being able to sustain their operations during this time. And we really wanted to help and step in to help them to continue to provide the work that they do. As I mentioned, we have supported a Blue Sky mental health service initiative to young people in middle and high schools throughout San Diego County at the Sweetwater Union School District, Oceanside Unified School District, as well as the San Diego Office of Education, Juvenile Court, and Community Schools. We've provided $25,000 countywide to support more than 17 back to school events to community-based organizations that we've partnered with, which have included the Latino Health Coalition, the YMCA of San Diego County, United Way, Stay San Diego, and the Boys and Girls Club of Greater San Diego. Oh, I also don't want to forget the Fallbrook Family Health Center and the Grossmont Health Center, as well as San Diego Parks and Recreation. There's others, and I hope I may have left some out inadvertently, but we really want to focus on that. We really reach out to the community and the community-based organizations that serve the communities of color. Next slide, please. And here's just a little overview of some of the unique partnerships that we've maintained and continue to support in San Diego County. You know, we feel it's important that we meet our community partners where they are and provide them the resources, the information, education, and services that they seek. We think this approach we've taken this approach through virtual events, youth programs, community sponsorships, and like I said, this slide is just a sample of some of our some of the impact that we've had over the last year. Some of our virtual events have highlighted mental health and mental health equity for the Latinx community, including youth and other peoples of color. Our sponsorships have provided some well-needed funding to support COVID-19 relief initiatives and community events surrounding mental health and equity advocacy. Our youth programs include a resiliency work group with over, and we've worked and partnered with over 30 community-based organizations who are working to reduce the stigma of mental health through social media and youth-driven art projects. And lastly, we've worked with partners such as the District Attorney's Office to implement virtual youth art paintings and the San Diego County Parks and Recreation to implement a mental health trivia game for youth. So all of these programs work hand in hand to really support each other and to support the communities that we all serve. Next slide, please. This slide is to provide folks an overview of the resources and the links to some critical resources for both physical health as well as mental health in particular. There's a link here on how to apply for Medi-Cal, both in English and in Spanish, and importantly, COVID-19 resources. And on the right-hand side, we have links for mental health services. Next slide, please. And I think this, I really like this slide. I think this really gives the message that I want to deliver today, that we are here for all. These are a few of my colleagues and who are in community engagement, Ms. Patricia King and Ms. Alejandra Ricardez, and also a telephone number to our member services for our CalMedi Connect program, our Medi-Cal program, and if somebody happens to be on Medicare, for that as well. Next slide, please. And lastly, I really want to express my deep thanks to the festival committee for inviting us today, and also to Alina. Thank you very much.
Thank you, Dr. Cruz. It was wonderful to learn about Blue Shield California. My novio, actually, that's his insurance company, so he was peeking over here listening. He was like, oh, let me hear more. Really excited to hear. So thank you so much. Let me see if we have any audience questions from our Facebook. But one of my questions for you is, I know you mentioned some of the locations where you're serving areas. I know you said Fallbrook, that's where my parents live. So shout out to my mom and my dad in Fallbrook. I'm pretty sure they're tuning in right now. But what are some frequently asked questions that you've had to deal with since the start of the COVID-19 pandemic in terms of just what are some concerns or safety protocols or any type of responses that you've had for individuals concerned with the pandemic?
No, thank you, Alina. There have been a lot of questions about both the virus and the vaccines that have been developed to fight the virus. So I think that the most important message, well, people ask, like, are they safe? Do they work? You know, do I have to pay anything? And I think the important message is yes, they're safe. Yes, they're effective. And yes, they're free. And you know, folks also have, because there's an awful lot of misinformation, and it's important that we really seek out trusted source of truth. And you know, many of the the organizations that we've been partnering with have been working with us hand in hand to make sure to get out the trusted source of truth. Some of the issues related to vaccine hesitancy stem from a fear. If an individual has an immigration issue, like, will this affect my status if as in terms of a public charge, you know, where because I'm receiving public services that might impair my ability to get my citizenship, and no, it does not. The information that an individual may share at the time they register for the vaccine is not shared with any immigration officials or anything related to immigration. The other question is, especially for ladies that are expecting, is the vaccine harmful to my baby? And we know, or fertility in case I want to get pregnant in the future. And the answer is, we've seen the vaccine is not does not impact or prevent fertility in the future. There have been, the data has shown that ladies who have received the vaccine and were not pregnant have been able to have a pregnancy and have a healthy delivery after that. One of the other questions is that commonly used is, there's some misperception that the vaccine is used, it has been developed using from fetal tissue, you know, from abortions or other things like that. And so on the basis of religious grounds, they're hesitant. And I just want to say that is not true. The genetic material that is used to create the vaccines are based on genetic material that has been developed over 20, 30 years. So there is no use of current use of, let's say, of aborted or human tissue in the development of the vaccine. So in fact, even the Pope has gone on record to say that the Catholic Church supports individuals getting vaccinated and encourages people to get vaccinated. So those are some of the more common ones that are out there that people have and ask about. Also about wearing masks. Yes, you still should wear a mask, and please follow the public health guidelines that are out there. We're dealing with a beast of a variant of COVID, the Delta variant, and so get vaccinated. Continue to use precautions of using a mask. Continue to try to adhere to social distancing, of keeping in, especially out in public, or if you're in the indoors area, like going to the grocery store, like that. And we'll all get through this. And I guess the last thing I'd say is, believe the science from the trusted sources, the medical scientists like Dr. Fauci, and your public health officials, the physicians and medical scientists that are working on this.
Thank you for that. All of that intensive knowledge. It reminded me, like, I've been checking out some scientific articles that have been out there on some of these misconceptions, such as the fertility from both woman and the male perspective. I was just reading a journal that had a paper published on that this week, so that was pretty interesting. We do have one question for you, and it'll be from your medical opinion. Do you see education begins at the home? Wanted to ask if you see schools going back to possibly a virtual environment because of the Delta strain and its sharp increase.
Yeah, this is a very fluid situation. I think that for children above the age of 12, because they are able to get vaccinated, I think it's going to be it'll be easier for us to have children at 12 and above go to school, go back to where they were going to school, whether it be middle school or high school. I think that for children that are 12 and under, we're going to see a vaccine, I think, very soon. I think probably before the end of this year, we're going to have a vaccine for children 12 and under. And I think that will make it more possible for it. But in the meantime, I trust what school districts are recommending and what the public health department are recommending. Again, trust the science. And people say, well, often one of the questions, well, it changes. Yes, that's the way science is. As we get more information, more data, we find out more and we make adjustments. And that's the way science works. There is no absolutes. And this, like I said, this virus does things like changes on us. And it changes on us because many of us are not vaccinated, and those that are not vaccinated get the virus lives, it reproduces, it changes. It changes to something that is harder to eradicate than it was before. So that's why it's so important to trust the science, get vaccinated, wear the mask, and continue to follow those good public health guidelines on what to do during this period of time. So we'll get there for children going to school. I said 12 and above. I see that that's going to be a much more easier route. 12 and below, we're going to have to follow what the school districts and what the public health experts say. But I see that there'll be there'll be a vaccine out by probably by the end of this year for children that are 12 and under.
That's very hopeful. Thank you for that. I did want to say personally that I think the only negative side effect of getting my vaccine was all the free Krispy Kreme donuts that I can acquire now, which I don't see as a bad thing. And I don't think anyone should see that as a bad thing. In fact, right now, you can get 2 donuts for free.
Oh. Now you can share one of them with your fiance, with your boyfriend.
Oh, he has his own vaccination card. We got 4 donuts in this house. So thank you again for your time. Thank you for answering these questions so in depth from your medical perspective. It's just wonderful to have you here. Thank you, Dr. Cruz. It was so great to share some time today with you.
Thank you, Alina. I appreciate being asked, and we're happy to come back next year. And I anticipate in person even.
Yes, hopefully. Yes. Thank you. So up next, we have Neighborhood Healthcare with Damaris de la Torre, Outreach and Enrollment Manager. And let's get into this, Damaris. Please let us know a little bit more about Neighborhood Healthcare.
Hi, good morning. Let me share my screen. Okay, hi, good morning, everyone. My name is Damaris de la Torre, and I work for Neighborhood Healthcare. So today I'll be sharing with you a little bit more of our organization and what we do, how we help the community. So we are a federally qualified health center. I'm going to share our mission and vision. Our mission is to improve the health and happiness of the communities we serve by providing quality care to all, regardless of situation and circumstance. And then on the screen, you can see our vision is a community where everyone is healthy and happy. These are just some of our numbers. So for 2020, this is the amount of patients that we served. This is the amount of visits. And then we had around 76,000 patients. Of those, 23,117 were children. And then we also had outpatient visits. We have been in service for over 50 years. Our clinic started back in 1969. We had a different name. We were called Escondido Family Health Center. So it's great, to know that we have been providing quality service in the community for a very long time now. We currently have 17 clinic locations and we are still growing. We have community clinics both in Riverside and San Diego County. For San Diego, we have several locations in Escondido, Fallbrook. We do specialty care, El Cajon, Lakeside, Valley Center, and Poway. And here you can see a list of the primary medical services that are provided. We do provide primary and preventative services for all ages, from prenatal all the way to senior-centered care. So again, it's open to any age. We also have pediatrics, senior services, and also women's health. We also provide behavioral health, different services such as counseling, psychiatry, and we also have like group for drug and alcohol programs, pharmacy and lab, and we also provide dental. And then we also have additional specialty services such as chiropractic, podiatry, and acupuncture. Because of the pandemic, we are able to also, help our patients by telehealth and also phone visits as needed. So we have in person, but then we also have these virtual options as well. Another great service that we have to offer to the community is our mobile health. So we have a dedicated team of medical assistants that are reaching our most vulnerable patients out in the community by visiting and providing services in their home. If they see that the patient, needs an appointment with the provider, they're able to do telehealth for them, right there and then. So that has been really helpful for the patients as well. And then another very key component, that we see that helps our patients is they, some of them have a lot of difficulties like social determinants of health. It can be a variety, maybe they're experiencing homelessness. They need extra social support, help with employment. As we come across these needs, we do have staff, they're called complex care coordinators that can meet with patients and help them identify, what services they can help them obtain and that are available to them in the community. So this is something that has really, helped patients improve, like health-wise. Sometimes, they need a lot more than just seeing a provider. So I think this is a great program that is available to our patients that need this extra support. And then specifically for our department, I am the outreach and enrollment manager. And we have certified enrollment counselors both in San Diego and Riverside County that help families enroll into these programs, such as Medi-Cal, Covered California, CalFresh. We also work with different brokers and health plans in our community. When someone is receiving Medicare, we can help them connect and they can select their plan. We also work with 211. We have a referral process in place as they identify, community members that need this additional assistance. They can refer them to our office for application assistance. And all the applications that are submitted are done online. They don't have to go back to the office, to the county office to turn in any documentation. We can help them with their application, filling everything out and then uploading the needed verifications. We can also help them troubleshoot if their case is denied or, they have trouble turning in certain verifications, we can help them navigate and really walk them through this process. And then as far as COVID-19, we do have a response team. We are currently focused on providing COVID vaccines to the community. And in the past have also, well, currently we do COVID testing, but in the past we were also doing like drive-through testing depending on the need of, the community. Right now, again, our focus is really the vaccination. We do have COVID vaccines every Saturday in our Escondido location from 8 a.m. to 12. And this is just a number of the amount of vaccines, roughly a number of how many COVID vaccines we have administered. And that's all the information I have for you. Please feel free to reach out. At the next slide is my contact information. There are a lot of programs and services that are available to the community. So, I would be more than glad to answer any questions and help you connect with the services that you may need.
Thank you so much, Damaris. Could you do a brief overview in Spanish for our Spanish-speaking listeners, please?
Yes. Hola, buenos días. Mi nombre es Damaris y trabajo para la clínica de Neighborhood Healthcare. Acabo de presentar información sobre nuestra clínica. Estamos disponibles aquí en el condado de San Diego y también el condado de Riverside. Tenemos varios servicios como doctor, quiropráctico, también consejería y servicios dentales. Estos servicios los ofrecemos para todas las edades, por ejemplo, de prenatal, servicios de la mujer, hasta la edad de seniors, de los que son mayores de 65. Específicamente en nuestro departamento tenemos asistentes certificados que les ayudamos con la inscripción de Medical, Covered California y estampillas de comida. Tenemos asistentes que le pueden ayudar en llenar su aplicación. Y si tienen cualquier pregunta, por favor comuníquense conmigo si gustan saber más, información de Neighborhood o gusta ser un paciente, es bienvenido y estamos listos para ayudarle. Aquí está mi nombre, mi correo electrónico y mi número directo. También puse ahí el sitio web y el número de nuestra clínica. Muchas gracias por su tiempo.
Thank you so much. So I do have a few questions for you. First question is if you have any, whether it be like in person or even over the phone, to help some of your the community sign up for any of your programs, or is it just all on the website?
So for enrollment assistance for Medi-Cal, Covered California, and CalFresh, we are helping patients apply in person. We do offer phone appointments if they need that, but we are open to the community. So that has really helped us, stand out. During COVID, I know a lot of locations moved to virtual assistance, but we have continued to work from the office.
Awesome. Thank you so much. And then one other question for you is, you mentioned the areas that you serve. I recognize some of the cities that you were discussing. So are there, because you have been in person throughout the pandemic, do you still offer, let's say, any, not just assistance, but classes or programs that help for better understanding? Are those, if you do offer them in person, is there a virtual aspect right now? Just question on that.
Yeah, so some of the programs that like we did offer before the pandemic was, for example, the Teen Wellness Program. That was a program where teens were invited to our health centers every week. And some of those programs, unfortunately, because of the pandemic, the group setting, we're not able to offer those weekly events. Another good one that we had was a senior program where we had a group of seniors that would come to our health center on Fridays. They would meet for like 4 to 5 hours and just socialize and play games and do activities. And yeah, unfortunately, they haven't, been able to resume those, but we are looking forward to them. Our complex care coordinators, they actually are the ones who are calling the patients and, asking them questions, helping them connect to different places that are offering different services that they may need. So that has been really helpful for our patients.
Oh, yes, that seems so wonderful. You're still doing that outreach, even if you can't host it, still finding the alternative for them. That's so great. Thank you so much. And I want to invite all of our panelists back just for a few quick questions that you are open to answer, whoever would like to put in an answer. I know we did have one in our Zoom chat that was if there was a fee to join AARP or if there was a fee for even Blue Shield or our neighborhood healthcare to use your services. So if anyone's open to answering that.
Well, Alina, for for Medi-Cal, individual, if they're eligible for Medi-Cal, there is no fee regardless of the health plan. It's an entitlement. So an individual is entitled to receive Medi-Cal if they're eligible. And so the only thing they need to be eligible to meet it is based on their income level. And if they were to reach out on the I think the link that I provided for understanding Medi-Cal, that there'll be more. It can ask more specific questions, but there's no fee to join.
So for neighborhood, we do accept, Medi-Cal, covered CA, Medicare. We also accept some private plans, but the benefit, of going to a FQHC is if the person is not eligible for any of the programs like Medi-Cal, for example, they do offer the sliding fee scale. So based on their family size and their income, they're able to receive services at a discounted price.
And if I'll step up for AARP, there is for membership a general $16 a year fee. That's for a spouse and or partner. But that gains you access to a whole different realm of activities and possibilities. However, during specialty months like Hispanic Heritage Month, they do lower that and it's like $8 or it can be free in many ways. So it's just looking on the website and seeing what is possible. And if not, you can always contact Tiffany or myself and we'll be happy to get you in the system so you can learn more about it before you'd want to join. But thanks.
Yes, thank you guys. Another question is, do your organizations offer right now any webinars maybe concerning health, types of prevention, nutrition services, anything along that realm that can't be done in person entirely right now, but online or in a hybrid setting?
I can jump in real quick and just offer that AARP offers regular monthly webinars on educational topics like caregiving, frauds and scams prevention, home fit, which is not an exercise program, but rather how to safely age in place, brain health, like we mentioned earlier, and then downsizing and decluttering has been a big topic recently. But we also do really great, webinar Wednesdays on our Facebook, similar to the setup that we have here, where we've done, get a update on COVID with your local public health officials, or really popular one that just happened that was, how to start a business after 50, or how to, build your financial resiliency. And there's some in Spanish and there's some in English. So just be sure to tune in to aarp.org/near you.
Awesome. That downsize and decluttering webinar sounds incredible. As a person who has a lot of things. I have just subscribed myself to the aesthetic of cluttercore. But maybe I should check out one of those webinars to see if I can change my aesthetic.
Blue Shield, I promise, we work hand in hand with our community-based partners, and we develop any webinars through them, as well as the physician groups and the clinics that we are partnered with. Many of them have special webinars that for the individuals that use their services, and but also that the majority of the physicians and the clinics have telehealth, so that individuals can either go online or are able to call in for their healthcare services.
Amazing. Thank you, Dr. Cruz. I personally do like the telehealth opportunities that you can get. Sometimes you don't want to drive to a facility, especially if you're worried about COVID. So it feels much safer to be able to talk to your physician or talk to a nurse or some health provider on the phone and get those questions answered. I love that opportunity that's come about.
It's proven to be very popular, and and even after we round the corner with COVID, I believe that it's going to be something that's still widely used and encouraged. I certainly encourage individuals to use and access their physician or their clinic, through any means, whether it be in on site, in person, and when it's safe, and also through other ways, whether it be telehealth or a phone. The key thing is to have that visit and have your questions answered or your needs addressed.
And I think it is a great opportunity, especially for those who are in a family setting or who are very busy with work and other activities. Sometimes you can't actually schedule that time to go take that drive to the office. So it seems flexible for your schedule.
Oh, right, exactly. You don't need to worry about transportation because you can just access online or on the phone.
Yes, thank you.
So for neighborhood, we aren't offering any webinars, but we have resumed community events. So we have already attended several events. A couple were like National Night Out. They had them almost in every city. And then recently we also worked with one of the school districts here in Escondido. We had staff that were there at the school registrations. So we have, received invitations, and we try to participate in as many community events as possible.
That is wonderful to hear. I love that you're partnering with the schools so that you can get into that level of access through the community. I want to thank everyone again for spending time with us this morning. It was so great to have you all. Great to hear about all the opportunities that you provide for the community. Various different opportunities, and then also some of the similarities that you guys are all just here to support our community, our family here in North County. So that's just wonderful to have you all here for that. Thank you.
Yeah.
Thank
you.
you.
Yes.
Para nuestras audiencias en español, solo quiero recordarles que la información en español para cada uno de los sitios web de los proveedores de salud, todos ellos tienen lo que es una opción para español. ARP, si van a su website, arp.org, habrá una sesión de la parte donde dice menú, y van hacia la parte de abajo, está la opción de que dice ARP en español. Le dan clic ahí y les lleva la información de ARP en español. Ahora, para Blue Shield California, si van a la área de arriba en la barra, está la opción de buscar el idioma en español en esa parte. Para Neighborhood Health, es en la parte derecha de arriba es donde van a encontrar la opción para la información en español. Okay.
Thank you so much, Anna, for showing us that. That was really great. And I do believe up next we have a wonderful opportunity and spotlight on a local coffee hut. I have not tried them yet, but I have seen them on Instagram, Twitter. I have heard that they are really, really good. So El Cafecito also has an opportunity for a gift card. So we'll talk a little bit more about that after this short video.
Welcome everyone. My name is Susan Morales. To highlight the Latino Book and Travel Festival. And our first business is Cafecito here off of South Santa Fe in Vista.
Hey everyone, my name is Rod,
This is Denise.
and we are the owners of El Cafecito located here in Vista.
Denise and Rod, tell us about El Cafecito.
So El Cafecito, we are a small coffee pot located here in Vista. We do have a very diverse menu with different flavors.
We are proud to serve drinks that inspire us. One of our drinks right now are developed memories. We did want to represent our community this week.
Being a Latino business owner is very important to us. Being Latino, I think for us means sticking together, which is why we started this community board right up here, where we have a lot of other Latino small businesses that are very supportive, and that's why we give back and show them.
We also like supporting other small businesses through our pastry. We do sell lunches that are filled, churro cupcakes, and we try to do it at least once a week with a different other small business.
So make sure to tune in to our live session on Wednesday, September 1st at 11 a.m. PST to get the opportunity to win a gift card from El Cafecito. Up next, we have a performance from Grapevine Elementary Choir. The Grapevine Elementary Choir consists of 4th and 5th graders who share a common bond, the love of music. Singing in choir helps students build their confidence and gain a sense of belonging. Singing in choir also strengthens students' musicality and listening skills. Every student needs an opportunity to experience the joy of singing. Make sure your school offers choir.
We're making music in our soul. We're making music in our soul. Oh, it's true, you can make music too. We're making music in our soul. We're making music in our soul. We're making music in our soul. Oh, it's true, you can make music too. La 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 la, la 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 la. Hey yo, hey yo, hey yo, hey yo. Do 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 do,
We're making music in our school. We're making music in our school. We're making music in our school. Oh, but you can make music too. We're making music in our school. We're making music in our school. We're making music in our school. Oh, it's true, you can make music too. Oh, it's true, you can make music too. Oh, it's true, you can make music too. Music in our school.
Thank you to Susan Stuber from Grapevine Elementary for providing the choir videos. Virtually making choir performances, and they did such a great job. Thank you for joining us today, and I want to just remind everyone to please follow us on Facebook at Latino Book and Family Festivals, so that you can keep up to date with all of our events that we are having during the Book and Family Festival this year. If you have any questions for our speakers while you are watching live, please write them in the chat or in the comments section on Facebook. And please let us know where you are watching from. I would love to shout out to individuals. It is so great to see where you are. Thank you again to all of our partners and presenters today. It was so wonderful to have them here for help. And thank you to our supporters. Lastly, do not forget to tune in to our live session on Wednesday, September 1st for the opportunity to win a gift card to El Cafecito. Thank you, everyone. It was so great to see you today.
Mi nombre es María Piedad Osorno. Llegué de 32 años a este país. COVID impactó nuestra familia, muriendo 3 familiares muy cercanos. Yo decidí tomar la vacuna precisamente por eso, para poder protegerme a mí y proteger a mis seres queridos. Tu salud es mi salud.
You're essential. Your life is essential. Your family is essential. That's why we need you to get vaccinated. So many of us have worked, sacrificed, and lost loved ones in the past year. Let's end this pandemic together. Get vaccinated. Thousands have already gotten the vaccine. It is safe and effective and is our best option to end this pandemic. So wear a mask and make a plan to get the COVID-19 vaccine. You can sign up on myturn.ca.gov.